Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today's special guest, Henda Salmeron, talks to Morgan Hare and Dr. Rohrich about her journey with breast cancer and what women need to know. And now, here's Morgan Hare and Dr. Rohrich.
Hi there from MD Source. It's Morgan Hare and Rohrich, our co-hosts of MD Source, giving you a more informed view about you, your health, your body, your life. And we're privileged today to have Henda Salmeron with us, who is the author of Henda's Law. And Morgan, you know Henda very well, and we're so honored to have you with us. So Morgan, tell us a little bit about Henda, and then I'm going to have Henda introduce herself.
Well, I met Henda because I knew she was talking about dense breast, and I wanted to hear what she had to say because we have the AIRS Foundation, and we're always talking to women who have breast cancer and how they've been diagnosed and how they weren't diagnosed. So I thought it would be really interesting to hear what you had to say, and I was really impressed with what you were doing, what you had to say, and how your diagnosis came about. So why don't you tell us something about yourself?
And then tell us about Henda's Law. Your law.
Your law.
I am originally from South Africa.
You can tell.
My Texan is slowly coming along, not going anywhere fast.
It's good.
Been here since 1990. Literally came with 2 suitcases and $500. Originally started out as a computer scientist, moved to Dallas, and since the last 17 years, I'm a real estate broker.
Right.
52 years old, and I received the diagnosis 1 in 7 women will get, but none of us want. I was told I had breast cancer. I had an 8-year-old and a 10-year-old, and it changed the spin of my world completely. And unbeknownst, the universe picked me to become a spokesperson and an advocate for women with dense breast tissue.
So what are dense breasts?
So dense breast has nothing to do with how your breasts feel, how big they are, how big you are, or it's irrelevant. Density is defined by the first time you have a mammogram, and it is the relationship of your tissue versus your fat in your breasts. Fat shows up dark on a mammogram, where dense tissue shows up white. Tumors show up white, so when you have very dense breasts or dense breast tissue, on a mammogram, you cannot differentiate between a tumor and your dense tissue. It's like looking for a polar bear in the snow.
And so, Henda, you sound like a doctor, so you obviously learned this the hard way. So tell us about your journey and why you're so adamant about this, and all what you said is so true that everybody needs to know about that.
What is shocking that most women don't know is 50% of women have dense breasts. And until 3D mammograms became the standard of care last year in Texas, almost 40% of tumors could be missed on a mammogram. So we're talking massive numbers. This is not a rarity. In my own personal journey, I had a baseline at 35. I had a mammogram religiously at 40, 41, and 42. And I truly believed that mammograms were foolproof. I was never informed differently. And in 2009, I was overweight, overworked, overstressed, all the overs you can add to a sentence. And I decided to change my style and become fit. And so over an 8-week period, I lost 12 pounds and I felt a little lump in my breast. When I called my physician and told her about it, she said to me, "Oh, you don't need to worry, it's nothing," because she just had a mammogram. Well, luckily, my then mother-in-law, who is a nurse, said to me, "Please don't believe them, go have it checked." So I went and had it checked again at a very renowned center here in Dallas. And once again, they were going to send me home.
And you had a mammogram and ultrasound, or just mammogram?
Just a mammogram.
Okay.
Couldn't see anything. And they said, "There's nothing here." And you know when you have that little voice,
Right.
You just know, right? And I texted my doctor and begged her to please check more. And then I had a sonogram, which led to a biopsy, which then led to my diagnosis. However, I felt confident that it was small and early because I was religious about my mammograms.
Right. You were your best advocate.
I was, and I felt I was informed.
That's right.
And so I transferred to UT Southwestern and had a mammogram, sonogram, and an MRI.
Perfect.
And 2 days later, I got a phone call from my oncologist surgeon, and she said to me, Ms. Salmeron, is it a good time? And are you sitting down? We shouldn't start conversations that way. And that's when I learned I had a later stage and a 4-centimeter tumor. 4 centimeters is the size of a golf ball, diameter of a golf ball. I was shocked, couldn't understand how can you miss a 4-centimeter tumor on a mammogram. And that's when I heard that it wasn't the standard of care to tell us. And every one of my mammograms indicated I had dense breasts. Well, dense breast tissue, we would never come up with those 3 words. Until then, I thought dense meant stupid. I mean, I could never have translated that to breast tissue. And I swore that day that I would change the standard of care.
Good.
And I started fighting for it the very next day. And 2 years later, Governor Perry passed Henda's Law. We were the second state in the United States to inform women about their dense breasts. And today, 7 years later, we have 34 states.
So tell us exactly what Henda's Law. Congratulations to you. I like you already. So tell us about it. What does it mandate?
So what it mandated in Texas is that every mammography center has to notify a woman about her density in her breasts. So Henda's Law, everywhere in Texas that you get a mammogram, your letter will include the verbiage that you have your mammogram indicates that you have dense breasts, and based on your risk factors, you should discuss with your physician if you should consider supplemental screening.
Which includes what? Ultrasound?
It could include ultrasound. It could include an MRI. We have new technology called a contrast-guided 3D mammogram.
Right.
It depends. What's extraordinarily critical, and so grateful for you guys having me today, what we now know is just having dense breasts is a higher risk for being diagnosed with breast cancer than having a family history of breast cancer. We also know tumors in dense breasts tend to be more aggressive than in non-breast tissue.
It's because they're probably missed much more often.
That's
right?
correct.
So do we know what causes dense breasts? I mean, how does that happen versus a breast that is not dense?
It's genetic. You are born that way. And over your lifetime, certain factors could cause your breast to become less dense. For example, hormone therapy, going through menopause. However, over your lifetime, if you have dense breasts, your breast will probably stay dense. A third of women post-menopause still have dense breasts.
So tell us about your journey. So you were diagnosed and then obviously treated.
Correct.
And you're doing great today. That's how many years later?
I am 9 years out, and since cancer, I've become an ultra-extreme endurance athlete. Very slow, but I've discovered that it's not about a race getting to the finish, it's about getting to the next checkpoint. So I run races longer than 150 miles all over the world. And it's my way of keeping myself fit. And because we also know being fit is another way to reduce your recurrence of breast cancer.
So I know that you've gotten Henda's Law passed in 34 states. Congratulations for making that happen. But you told me in the armed forces, they still don't tell you you have dense breasts on a mammogram, and there's still 14 states that have not passed this law. What are you doing to get the law passed in the other states and with the military?
So it's not known as Henda's Law in the other states. However, we have density legislation that was Henda's Law helped other states to get it passed because we were the second state and we're a big state. Let's just be honest, Texas matters, right?
Always.
Everything is better here. And bigger.
Absolutely. And bigger and better.
But it really is a concern for me that there are still 14 states that don't have it. I don't want, if you are unlucky to live in one of the 14 states, not to know this. And women are dying. We can treat breast cancer today if it's found early enough.
Have these 14 states had legislation up for passage, or has it not been done?
There's a combination. Some have pending legislation, but there are many of them that have no legislation. What we have found, it's predominantly driven from a grassroots perspective.
So what can we do? It
seems
like it's a no-brainer.
So now that the midterms are over, I am wanting to take this to the federal level. We have legislation already in the House and the Senate and at the FDA. My commitment is to bring the Texas senators and U.S. congressmen to support this legislation because the armed forces does not fall under state law.
It's federal.
It's federal. So I want the FDA guidelines to be changed for the Mammography Quality Standards Act.
Yeah.
That's what needs to change.
Right. This needs to be a national federal law.
Absolutely.
I mean, it's just a no-brainer.
It's a nonpartisan issue. It is a very important women's health issue.
So if women want to get involved and they want to know if their state has passed this law or if their state hasn't, how do they check that?
They can go to hendaslaw.com, and I would love them to register their support. I'm seeking 50,000 signatures from women that I can go to our congressmen and senators and across not just Texas but other states. And then you can literally Google also, and there's a map. If they, again, go to my website, there is a map that indicates whether your state has it or not.
So if someone wants to get in touch with you, is that the best way
Yes,
to do
that
it?
is
To go to your
absolutely.
website and then they can see. And for the 50,000 signatures that you need, is that just anyone in the country or do they have to be in those states?
No, anybody. And I believe that we will have the support from our politicians, but the more I've learned, this is grassroots. I was able to have a law changed. I'm an immigrant. I never walked into the Capitol until I showed up as a lobbyist. And I've just learned that from a grassroots perspective, we can make change happen.
Absolutely. I mean, it just sounds like it's totally nonpartisan. It's something that needs to be done. It needs to have been done years ago. And I just think, I mean, I certainly know several U.S. senators, and I just don't think that anybody would oppose this. It's kind of a grassroots women's health issue that's long overdue.
The other really important issue that I now understand, we also have to educate primary care physicians. They don't understand density either. They don't know what dense breast tissue means. So I am also working with several hospital systems to help educate radiologists and breast surgeons and many plastic surgeons that
Right.
work in reconstruction understands what we talk about, but there are many primary care physicians that have never heard dense breast tissue either.
Right, who actually see
That's correct.
all women every day, and OB-GYNs, primary care doctors. I think that's a very important
Internal
point.
medicine doctors.
Internal medicine. Yes.
I have one more question. So if you have dense breasts, could you actually feel that your breasts are dense?
No, you cannot feel it. It does not anything to do how perky they are or not. It is only a mammogram can indicate whether you have dense breasts. And I would love to encourage all women to have a baseline at 35. Go get it done. If you don't have dense breasts, you've checked the box. If you have dense breasts, you need to become an advocate and really understand your own history and risk factors.
So right now the recommendation is a woman should wait until she's 40 to get a mammogram. And you're saying 35. What do you need to do then when you go to your doctor and say, I'm 35, I want to know if I have dense breasts?
What I have heard is, as a 35-year-old, if you walk into a mammography screening facility and ask for a baseline, your insurance most likely will cover that.
That's right. I mean, the standards have been actually at age 40, and then some groups actually have advocated doing it later, which of course we don't advocate.
I will be dead. I mean, if the guideline was 50 and I waited until I was 50, I would be dead today.
I agree. So that actually needs to be part of a national law, not only mandating it, but perhaps even moving it up to a younger age in the 35 age group. And I think
with dense tissue, the younger women are the ones that are at a higher risk
right.
of tumors being missed.
What words of wisdom do you have, having been through this, for our listeners about not only breast cancer, but dense breasts, but also what are the things that they should know and seek out if they're in their 20 to 35-year-old, and you can't really do the self-breast exam, which is the best way to usually detect breast cancer, but the self-breast exam won't tell you if you have dense breasts. So.
No, but if you know your breast, like for example, in my own case, I found my lump myself through a self-exam accidentally.
Right.
I wasn't certain. My biggest advice is you need to understand your body. You need to understand when something's there that wasn't there before.
Right.
And go to Dr. Google if you don't have good access.
Or now go to MD Source.
Right. I'm joking. You should not listen to Dr. Google.
I agree.
But information is available. We have access to understand about our bodies. And I think it's very important for women in particular to own their breasts. Look after them and understand their makeup, understand their risks. Go get your BRCA genetic testing. It's becoming cheap, $99. You will know whether you have the BRCA gene.
Right.
However, we also need to make sure women know that 85% of breast cancers occur in women that are BRCA negative, that do not carry the gene.
That's right. Well, those are very wise words, Henda, and I think that they carry a lot of weight coming from somebody that actually has been through it and appropriately named Henda's Law. And I think that you should be congratulated for being so selfless and getting all American women and all women globally on board with this.
We know today that survival lies in early detection.
Absolutely.
I don't care what cancer it is. And with dense breast tissue, you are at risk of not getting an early diagnosis. And that is just not good enough.
Yeah, and that is a true fact that actually the early diagnosis, the early self-exam has actually been the main reason in North America why breast cancer detection and survival rates have increased, because of the early detection at earlier stages. So Morgan, any final thoughts?
No, again, if you want more information about Henda's Law, go to hendaslaw.com.
It's like Honda, Henda, Henda's Law.
Henda's Law. And are you on Facebook and Instagram?
Everywhere. Yes, of course.
So what's your handle on Facebook and
Henda's
Instagram?
Law.
Henda's Law.
LinkedIn, Twitter. Yes, everywhere.
Everywhere. Okay.
And I do believe we can move this. What do you move, cheese or dial? English is my second language, but we're going to move this regardless.
Very good, and I like your Texas South African accent. It's fantastic. Listen, and thanks so much for spending time with us at MD Source. I mean, this certainly is really one of the main reasons that we formed MD Source, is to have a more informed you, a more truthful you that really affects your body and your life, and this really epitomizes that. So
we must become advocates for ourselves.
Right. No one is a better advocate for themselves than us, and that's the take-home message. So, thank you again.
Thank you for having me.
You bet.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.